Good morning. I'd like to share 5 general healthcare trends that might help you grow your businesses. Here's Rita Wilson, the Huffington Post's new Post 50 editor-at-large and poster child for healthy aging. In 4 years, people 50 plus will make up about 45% of the U.S. population, and baby boomers are very much the driving force behind the healthy aging. Did you know that 2011 marks the year baby boomers begin to reach retirement age? Today we have roughly 40 million adults 65 plus in the country, and by 2050 that number is expected to more than double to 89 million. An aging population means a growing need for healthcare jobs. The Bureau of Labor Statistics estimates a 48% growth in health-related occupations from 2000 to 2016, and a 35% growth in health practitioners compared to a relatively flat line for other occupations. As Dr. Joe Ivy Buford states, it's too limiting to shape health policy on aging as only a problem and not also an opportunity. Trailblazing baby boomers are going to broaden the market for new products and services in the lifestyles of health and sustainability industry. From a marketing perspective, think health service rather than health care when targeting baby boomers. Another demographic trend that affects healthcare in a variety of ways is the changing racial and ethnic makeup of the population. In New York alone, close to 30% of the population speaks a language other than English as their primary language. The proportion of Hispanics and Asians in the U.S. grew 43% in a 10-year period compared to Caucasians at 6%. In absolute numbers, Hispanics grew from 35 million in 2000 to 51 million people in 2010. And by mid-century, Hispanics will nearly triple in size to a projected 132 million people, or 30% of the U.S. population. The importance of the Hispanic market cannot be overstated, especially when we look at the uninsured and underinsured population and the implications for healthcare delivery in 2014 and beyond. While Hispanics account for 16% of the total U.S. population today, they account for 39% of all uninsured. Similarly, African Americans and Asians also over-index on lack of coverage. When we think about providing quality and cost-effective care for minority populations, we have to think much more broadly than demographics. As we see in this chart, only half of African Americans trust their healthcare providers almost all the time, compared to 71% of Caucasians. What this implies is that regulation alone is not going to change behavior. We're going to need communication specialists, translators, and people trained in cultural competency if we want minority uninsured populations to change attitudes and behaviors. Let's talk about cost containment. Healthcare costs have skyrocketed over the last 10 years. Expenditures in the United States on healthcare surpassed $2.3 trillion in 2008, more than 3 times the $714 billion spent in 1990. Healthcare premiums have tripled since 2000 and are projected to double over the next 10 years to an average annual outlay of $32,000 for a family plan compared to $15,000 today. We've been hearing a lot about what the government is planning to do to curb costs and improve the quality of care. Employers, too, are using a variety of cost containment measures as well. While executives at large companies will continue to push more health insurance costs onto their employees in 2012, smaller businesses strapped for cash are facing even greater challenges in providing health care coverage to their employees. In this chart, we see that cost shifting of health insurance premiums and co-pays to workers is short-sighted. According to IMS Health, the number of doctor visits and filled prescriptions has fallen in recent quarters. Trend number 4 is one that is near and dear to my heart as a researcher: consumer empowerment. The result of consumer empowerment is the recognition that each person or consumer has a voice and is important. If you don't believe in consumer empowerment, look no further than DTC advertising budgets. In 2009, direct-to-consumer advertising spend was $4.5 billion. In that year, Pfizer far outspent its competition for its blockbuster drugs Viagra and Lipitor. E-health is a prime example of tools consumers now have at their disposal to help them diagnose their own symptoms, find doctors, set appointments, and compare procedure costs. There's tremendous potential for e-health to improve the quality, capacity, and efficiency of the healthcare system. Beyond interactive tools, the next progression in consumer empowerment is the use of social media. In this space, it's important to engage and shape the conversation, and yes, to monitor what's being said about your company. 60% of patients engage in some form of social media regarding their health. The CDC is a great example of how a healthcare organization can effectively embrace social media. The organization's efforts have yielded impressive results. Over 1.2 million Twitter followers, 150,000 fans on Facebook, and 2.8 million people per month visiting the CDC website. AHRQ is part of the U.S. Department of Health and Human Services. It has a fantastic site that incorporates compelling videos to empower patients. Let's take a look at one.
When I was 22, I was diagnosed with premature ovarian failure, and that led to a hysterectomy. They stuck me on progesterone, which threw my body into overdrive, like a hormone overdrive. My moods were going up, they were going down, and I was diagnosed with bipolar disorder. And they had me on different medications. But the thought in my head was kind of like, something is not right. I started doing some research online, just try to find out any kind of information about hysterectomies that I can to see if I can kind of connect the dots with things. At first, I felt a little nervous questioning my doctor about my own findings of what I found online and what I had researched in books. And I brought out my papers and I said, what if we just did estrogen? What are your thoughts about that? She was like, well, I'm glad you asked that question. When you hear that key thing, I'm glad you asked that question. When you hear that, it's this weight that is lifted off your shoulders like, whew, okay, all right, now we can go forward. I think a successful patient-doctor relationship is being able to ask one another questions and being able to be open. We each bring something to the table. I have the personal knowledge that I have gained from doing my research. He's got the education, he's got the expertise, and putting those two together, it's like a match made in heaven.
The fifth and final trend I'd like to share with you is personalization. Personalization is the key to consumer engagement. I purposefully left this trend for last because engagement and building relationships with customers, patients, employees, or donors is what companies are striving for. Ironically, it's through advances in number crunching and data warehousing that personalization can be achieved. To set the stage for this trend, let's take a look at how Aviva touts their ability to personalize customer service as a competitive advantage.
At Aviva, we wonder why other life insurance companies treat you like a policy, not a person. Instead of getting to know you, they simply assign you a number. Aviva is here to change all that. We're bringing humanity back to insurance and putting people before policies.
Given the advances in computing power, it's not by accident that personalization is manifest in all aspects of healthcare. Chief among them is personalized medicine. A key challenge to advances in personalized medicine are data silos. For those of you in IT, organizational development, and consulting practices, I urge you to help healthcare organizations and the life sciences break down those walls in order to accelerate the promise of personalized medicine. Personalized communications can help motivate patients to take a more active role in healthy living. Crafting compelling messages and delivering them in cost-efficient ways is a win-win for patients and the bottom line. Different patients will respond to different messages. For example, some are concerned about side effects, many have difficulty changing routines, and others simply lack visible symptoms. Through advanced analytics, one of our clients, Pitney Bowes, helped a pharma company determine the optimal content and communication channel for specific patient segments, which resulted in an 8% reduction in prescription drop-off rates and a 60% reduction in per-patient communication spend. And of course, the most personal communication platform companies are beginning to leverage is the mobile device. Not surprisingly, mobile health monitoring has both provider and patient support. It's time to put all the pieces together. You might be asking, what do these trends mean for your business? While it's true that experience is the mother of invention, innovation is a process that you can control to develop successful new products and services in your company today. And how you do that is by listening to customers. It begins with discovery, identifying the customer's pain points and needs. This can be accomplished through primary research, social media monitoring, secondary data searches, or all three. Next is the ideation phase. Given the consumer's pain points and your core competencies, what can you develop in your own company to address these needs? This can be accomplished through brainstorming with your staff and/or through co-creation with your own customers. Finally, it's important to test your concept and red flag it prior to development and launch in order to validate it, predict take rates, and even simulate various what-if scenarios for such things as pricing or sales channel. I want to end my presentation with an example of an organization that gets it right, an institution that listens and one that cares. The City of Hope, one of 40 designated comprehensive cancer centers.
There is no profit in curing the body if in the process you destroy the soul. Everyone uses the same phrases, which is, it's so different, it's so special, it's so meaningful. How do you create such an environment? And the answer is, I don't create this environment. This is the environment that I've been lucky enough to inherit. Patient care is special here not because of some choreographed sequence of hugs or attention. It's the unique empathy and understanding of what does a patient need at that moment. For some people it's facts, cold, simple, straightforward information. For some people it's just listening to what they have to say. It's got to be this whole repertoire.
In the words of a 22-year-old brave Hodgkin's lymphoma survivor, he writes, "Before I came to City of Hope, my family and I consulted another hospital about my treatment. I left terrified, but the minute I got to City of Hope, my nerves were calmed. I remember walking into the main doors, being greeted by everybody, having a full itinerary laid out for me with all my questions ready to be answered by any number of people. At the time, they made us feel like we were the most important people at the hospital. I was stress-free from the moment I walked in, even though it was the most stressful situation of my life." These, then, are the tools that you can use in your businesses to grow in this environment. Thank you very much for your attention.